this and a talk like this, where you think 20 years ago, that just wouldn't exist. So I think like anything else, you just get more awareness, so there might be more in the media. And just
well, I was diagnosed bipolar, wow, 16 years ago.
Next to Normal is groundbreaking musical theater, but even more importantly, it's an opportunity for outreach and education about mental health in the community. Please stay with us after the show. We'll be having a panel discussion with Dr. Michael Pruitt, Michelle Hardman of Corporate Care Works, and Laura Inman to talk about bipolar disorder and some of the issues that you're going to see dramatized in the show tonight.
I could say something about stigma. It's a lot better than it was 20 years ago, but it's still there. I know, I wrote a book about my experience, if anybody wants one later. And can I do it? That's it. And when I first started writing about it, and I would say I was writing a book, and someone would ask me, well, what's it about? I was too ashamed to say it's about depression. I mean, I have depression. I really was terrified that somebody would find out that I had it. Well, you know what? I've written a book and it's out there, and I think that as you get older, somehow you just come to accept it better. You know, if people are going to judge you because you have an illness that's not any different than heart disease or I can never remember diabetes. Thank you.
Yes.
I mean, nobody chooses mental illness any more than they choose any other illness. So I think that the biggest problem we have right now is educating the rest of the United States of America and the world about mental illness, and that is an illness.
I will hold it all together with a perfect loving family. If they say we're not, then fuck them. With a perfect loving family, I will keep the place on spinning, and the world just keeps on spinning. And I think the house is spinning.
Sweetie, is everything okay?
Dad.
Go on ahead, you'll miss the bus.
Also, bipolar disorder, it's very difficult for even psychiatrists to diagnose and treat a lot of times. The diagnosis usually starts with a few episodes of depression. You don't actually see the mania usually until about the third or fourth episode, and that can be 5 or 10 years down the road. So people get treatment for depression and kind of get misdiagnosed and things happen, and then ultimately you'll see the mania like you saw with Diana in the play. And the mania can just come out of nowhere and be full-blown, and that's when you get the diagnosis of the bipolar disorder. Did that happen with you, with your?
Well, I'm actually diagnosed as bipolar 2, which is different than bipolar 1, which simply means that, I always have to be different, it simply means that on the high end or the manic end, you don't have the really extreme highs, you just have kind of mild highs, and I have to say, hypomania, which is what it's called, which literally means mild mania, was awesome. If I could maintain that state forever, I would have loved it. But unfortunately, you can't do that. If you go up, you come way down.
And bipolar disorder is on a continuum, just like she was mentioning. You have standard bipolar disorder, bipolar 1 disorder, which is the real big highs, the really big lows. You have what's called bipolar 2 disorder, where you have the hypomania, go up a little bit, and then the mild episodes of depression where you go down a little bit. And then you have cyclothymia, which is a very similar disorder, and you have kind of mood swings like this in the middle, not too big, not too little, but not quite as much as the bipolar 2. So this, like most conditions, is a spectrum disorder. You have people that have mild cases, people who have severe cases. And you also have people who have this disorder combined with schizophrenia, which is like a double dose of getting knocked in the head. And that's horribly tough to deal with.
Often excellent phosphorus Xanax, depth of cut blown up in ambient Prozac. Ativan calms me when I see the bills. These are a few of my favorite pills.
Ooh, thank you, doctor. Valium is my favorite color. How'd you know?
The psychiatrist is going to actually sit down with you, explain what your options are in terms of medications, tell you what the side effects and the risks are versus the benefits, and then the two of you make decisions together about that.
And I think there are fewer and fewer psychiatrists that actually are able to spend the time, unfortunately. But
Yes.
you know, with insurance and all the other factors, I think it's so important to be able to, whether you can get that all in one psychiatrist or you do need another, you know, resource or two or three or four to have that ability to address things like grief and things that come up on a daily
I think
basis.
a long, long time ago, correct me if I'm wrong, but psychiatrists also did talk therapy.
We love anyway. Look, I know you can't tell me if you're still treating her. I just want to know if she's okay.
I think she's working on it, and she's aware of the risks.
Do you think she'll ever come home?
It's hard to say.
Right.
Dan, would you like me to recommend someone for you to talk to?
We have so many people we have to treat now with mental illnesses. We really don't have a lot of time to spend doing psychotherapy, so we kind of send that out, farm that out a little bit to the psychotherapist, and then the psychiatrist mainly manage medicines and kind of give supervision to the therapist in terms of what directions to go. Another one is reimbursement. Psychiatrists don't get reimbursed very much for psychotherapy, but they get reimbursed a lot for treatment medications. Yes.
Along those lines, is it a problem to get health insurances to cover bipolar disorder, or is it pretty well recognized by health insurance?
In the United States, we now have mental health parity nationally, which requires health insurance companies to provide services for bipolar disorder, depression, all the mental health issues. And they have to provide it at the same level as they would for someone who has diabetes or high blood pressure. That's just been in the last few years. And that's pretty amazing.
And it's so much more than just theater. And it was very intimidating because I wanted to make sure that we did it justice. So I think my feelings were just one of approaching it with a great deal of respect and giving it the time and effort and the work that it really deserves.
So cold, we ran him inside, lost, worrying, wandering, that hospital room, that gloom. How could I ever forget?
How could I ever forget?
Screaming at
I
doctors,
was so
alarmed, upset.
upset.
They said
Diana,
to wait.
don't
They
you
never
think this
said
will
we
help,
were
but
too
it
late.
won't.
And I was a child, raising a child. Those weeks full of joy. Then a moment of dread. Someone simply said, your child is.
There was a lot that I had to kind of prepare myself for. Like, obviously, I don't have a mother who is bipolar, so I kind of had to put it into perspective as to what it might be like.
I don't need a life that's normal, that's way too far away. But something next to normal would be okay. Yes, something next to normal, that's the thing I'd like to try. Close enough